Our National Health Service is 70 years old today. And as the NHS celebrates its birthday, we paid a visit to Grimsby's Diana, Princess of Wales Hospital to speak to staff on this historic occasion. We also feature pictures of 70 dedicated staff at the hospital in a special tribute to their work. When then Health Secretary Aneurin Bevan launched the NHS at Park Hospital in Manchester on July 5, 1948, it was the climax of a hugely ambitious plan to bring good healthcare to all. For the first time, hospitals, doctors, nurses, pharmacists, opticians and dentists were brought together under one umbrella organization to provide services that are free for all at the point of delivery. The central principles were clear: the health service will be available to all and financed entirely from taxation, which means that people pay into it according to their means. Some of the staff at Diana, Princess of Wales Hospital on the 70th birthday of the NHS, image, John Corkin. Over the last 70 years, there have been many changes in the NHS and staff at Northern Lincolnshire and Goole NHS Foundation Trust, NLAG, which runs Grimsby Hospital, knows this better than most. But at the core of the NHS, the beating heart remains the staff, hundreds of men and women across North East Lincolnshire, from doctors and porters to receptionists and nurses. And it is those staff that Dr. Peter Redding, chief executive of the NLAG Trust, dedicated his tribute to the NHS as it turned 70. He said, "As the NHS turns 70, we have much to celebrate. We have a richly diverse and talented workforce who are dedicated to their patients and local community. I am incredibly proud of all our staff, from those working on the front line to those in back office functions. Without each and every one of them, we would not be able to provide the care we do for the 2,000 patients we see across the trust every day." The NHS may now be celebrated as one of the finest social welfare programs in the world. But its creation came against fierce opposition from some. Initially, doctors and GPs, who were paid by patients, strongly opposed the principle of free healthcare when the debate came to national prominence after the Second World War. The NHS was first mentioned in the Beveridge Report in 1942, which had recommended that when Britain emerged, hopefully free, from the Second World War, it would be a fair place to live without poverty or want. The report's author, economist William Beveridge, recommended a welfare state and a state-funded system of social care. It included the first public mention of a National Health Service. Adopted by the newly elected Labour Party, the policy of free national healthcare was driven with fiery passion by Welsh hard-left government minister Aneurin Bevan, above. It was designed, said Bevan, to stop healthcare remaining as a commodity, which was bought by patients and sold by doctors. Fundamentally, Bevan's NHS should be available to all, regardless of financial circumstances. And after extensive consultations, conference, public tours and votes in the House of Commons, it was finally launched by Bevan, on July 5, 1948. It was based on three core principles, which remain at the NHS core to this day: that it meet the needs of everyone, that it be free at the point of delivery, that it be based on clinical need, not ability to pay. Bevan argued that a national health service would save lives and improve the welfare of millions. In a speech to the House of Commons, in 1946, he said, "Great Britain is able to embark upon an ambitious scheme of this proportion. When it is carried out, it will place this country in the forefront of all countries of the world in medical services. I believe it will lift the shadow from millions of homes. It will keep very many people alive who might otherwise be dead. It will relieve suffering. It will produce higher standards for the medical profession. It will be a great contribution towards the well-being of the common people of Great Britain." Dr. Redding said he felt humbled by the dedication and work of staff, particularly in the face of huge challenges. He said, "In my 10 months at the Trust, I have witnessed staff go above and beyond on many occasions, particularly through what was one of the toughest winters I have seen in my 30-plus year career in the health service, and I am humbled on a daily basis by their care and compassion." For NLAG, there have also been structural and financial challenges. Last year it was placed into both financial and quality special measures but has been praised for making progress in recent months. Dr. Peter Redding, Chief Executive of the NLAG Trust, Image, Grimsby Live. Dr. Redding said, "I acknowledge that we face many challenges at NLAG, but everyone is working hard to overcome these and we are starting to see the first green shoots appear. So as we celebrate this significant milestone in the history of the NHS, I would like to take this opportunity to say a big and well-deserved thank you to all of our staff. Would you pay 1p more to fund the NHS? Have your say in our poll why I love working for the NHS in Grimsby." Dave Sprocka, Medical Recruitment Manager at the Diana, Princess of Wales Hospital in Grimsby. Image, John Corkin. Dave Sprocka is a recruitment manager at the NLAG Trust which runs Diana, Princess of Wales Hospital. He turns 37 today, the 70th birthday of the NHS. "I joined the NHS when I was 17, starting in the youth training scheme, and I will have been working for Northern Lincolnshire and Goole NHS Foundation Trust for 20 years this year. It is a great place to work and has been where I have grown my career. I have worked in HR, medical staffing, and now I am the Trust's recruitment manager, responsible for the recruitment of medical doctors. I am fortunate enough to have worked with some really great professionals in my career, and I am grateful that I work with such a brilliant team, who all really demonstrate the meaning of we care. NLAG is a place where you always see a familiar face, a place for opportunity and development, and a place I am proud to work."